Hello, friends. There is a federal program right now that will pay your entire Medicare bill for you, and more than 6 million seniors who qualify have never even applied for it. I am not talking about a small discount or a one-time rebate. I am talking about your monthly premium, your deductibles, your co-pays, and your co-insurance all covered completely. The money has been sitting there for years, and every single month that goes by without you applying is another month you are paying out of pocket for something the government will cover. I went through the latest federal rules, the income limits, and every change that took effect in 2026, and I am going to walk you through exactly who qualifies and how to get it. Stay with me until the end, because there is a brand new automatic enrollment rule that most people have never heard of, and it could be the most important part of this entire video. Before we get into the details, if you are not subscribed to this channel, please take a moment right now and hit that subscribe button and turn on the bell. Here is why it genuinely matters for you and for anyone in your family who depends on Social Security or Medicare to get by each month. The rules around Medicare change every single year. Income limits shift, new programs open up, old ones get updated, and deadlines come and go without any warning. What I do on this channel is take those changes, break them down by what they actually mean for your specific situation, and get that information to you before it is too late. The people who are subscribed to this channel find out about these programs in time to apply for them and actually receive the money they are owed. The people who are not subscribed tend to find out after the enrollment window has closed, after the deadline has passed, and after another year of overpaying is already behind them. Hit subscribe, turn on the bell, and let us get into this together, because what I am about to show you could save you thousands of dollars every single year. The programs I am talking about are called Medicare Savings Programs, and they are run through your state Medicaid office, not through Medicare directly. There are 3 main programs, and each one covers a different level of help depending on how much income you bring in every month. The most comprehensive one is called the Qualified Medicare Beneficiary Program, known as QMB, and it covers virtually everything that Medicare charges you out of pocket. QMB pays your entire Part B premium, which is $202.90 every single month in 2026. That is almost $2,435 a year. But it does not stop at the premium. QMB also covers your Part B deductible, which is $283, your copays, and all of your coinsurance charges. If you do not have free Part A through your work history, QMB even covers that premium, which can run up to $518 a month on its own. When you add all of that together, QMB can save a qualifying senior anywhere from $3,000 to more than $5,000 every single year in out-of-pocket Medicare costs. Now, a lot of people assume that once they have Medicare, they are fully covered and there is nothing else to look into. But that assumption is costing millions of people real money. According to the federal data, less than half of the seniors who actually qualify for these programs are enrolled in them right now, which means more than 6 million people are eligible and missing out. Nobody at the agency is going to call you and tell you this exists. Nobody is going to mail you a letter explaining that you qualify. And nobody is going to enroll you on their own. So, let us go through the exact income and resource limits right now so you know whether you or someone in your family qualifies for these programs in 2026. For the QMB program, the most comprehensive one I just described, you qualify if your monthly income is below $1,350 as a single person. If you are married, the QMB income limit for a couple is $1,824 a month, and your combined countable resources must be below $14,910. The second program is called the Specified Low-Income Medicare Beneficiary Program, or SLMB, and it covers your full Part B premium of $202.90 per month. The income limit for SLMB is a bit higher, up to $1,616 a month for a single person, and the resource limits are the same at $9,950. The third program is called the Qualifying Individual Program, or QI, and it also pays your full Part B premium with an income limit of $1,816 per month for a single individual. Now, here is something that a lot of people do not realize. 13 states plus the District of Columbia have completely eliminated the asset limit for these programs. That means if you live in Alabama, Arizona, Connecticut, Delaware, Louisiana, Maine, Massachusetts, Mississippi, New Mexico, New York, Oregon, Vermont, or Washington, your savings in the bank do not even count. Picture a widow in New York living on $1,300 a month from Social Security. She qualifies for QMB and could save over $3,000 a year starting the month she applies. You have to apply for this yourself. It does not happen on its own, and nobody at Medicare or Social Security is going to walk up to you and hand you this money. Now, here is the part of this video that almost nobody is talking about, and it involves a federal rule that changed how enrollment into these programs actually works. In September of 2023, the Centers for Medicare and Medicaid Services finalized a rule that requires states to automatically enroll certain people into the QMB program without a separate application. Starting October of 2024, if you receive supplemental security income and you are enrolled in Medicare, your state is now required to put you into QMB automatically. That means if you are an SSI recipient with Medicare, you may already be entitled to QMB coverage right now, and nobody told you to check whether your state has processed your enrollment yet. The federal government estimated that more than 860,000 people would become newly enrolled in Medicare Savings Programs as a direct result of this rule change. Now, I want to be straightforward with you because this is important. Congress passed a law called the One Big Beautiful Bill in July of 2025 that put a pause on some of the newer provisions. That pause delayed certain requirements, like using extra help data to automatically start an application. But the automatic QMB enrollment for SSI recipients was not affected and remains in full effect. If you currently receive SSI benefits and you have Medicare, call your state Medicaid office today and ask them directly whether you have been enrolled in QMB because you are supposed to be. If you are not on SSI, but you think your income is low enough to qualify, you still need to apply on your own, and I am going to show you exactly how to do that in just a moment. The reason so many people miss out on this is because the system requires you to know these programs exist and then take the step of applying, and most people simply never hear about them. Here is another benefit that comes along with these programs that almost nobody realizes, and it involves your prescription drug costs dropping to almost nothing. If you get approved for any of the 3 Medicare Savings Programs I just described, you are automatically enrolled in a program called Extra Help, also known as the Low Income Subsidy. Extra Help means the most you will ever pay for a covered prescription is $5.10 for a generic drug or $12.65 for a brand name drug. Compare that to what most people without Extra Help are paying right now: $50, $80, sometimes over $100 a month for a single medication out of pocket. On top of that, the annual out-of-pocket cap for Part D in 2026 is $2,100. But with Extra Help, your costs stay far below that ceiling every single year. You do not need to file a separate application for Extra Help if you are approved for an MSP, because it kicks in automatically the moment your Medicare Savings Program enrollment goes through. That one application to your state Medicaid office triggers 2 programs at once: the premium savings from the MSP and the prescription drug savings from Extra Help. So, here is exactly what you need to do right now if you think you or someone in your family might qualify for one of these programs, and it starts with one phone call. Step 1 is to check your monthly income against the limits I gave you, under $1,350 for QMB, under $1,616 for SLMB, under $1,816 for QI. Step 2 is to contact your state Medicaid office directly, and the easiest way to find them is to call Medicare at 1-800-633-4227 and ask them to connect you with your state program. Step 3 is to ask for a free counselor through the State Health Insurance Assistance Program, known as SHIP, by calling 1-877-839-2675, because these counselors will walk you through the entire application for free. If you want local help, dial 211 on your phone. That is the National Social Services line, and they will connect you with someone in your area who can help you apply in person. Do not let the paperwork intimidate you. In many states, the application is a single form, and in some states, they can even start the process over the phone, right there on your first call. The single most important thing is to make that first call today, because every month that passes without applying is another $202.90 coming out of your Social Security check that does not have to be. So let us bring it all together right now, because everything I just covered could save you or someone you love thousands of dollars starting this year. Medicare Savings Programs are federal programs that cover your Medicare premium, your deductibles, and your copays, and more than 6 million seniors who qualify have never applied for them. QMB covers everything if your income is under $1,350 a month. SLMB and QI cover the full Part B premium at slightly higher income limits. A new federal rule now requires states to automatically enroll SSI recipients in QMB, and if you receive SSI, you should call your state today to confirm your enrollment. Getting approved for any Medicare Savings Program also triggers automatic enrollment in Extra Help, which drops your prescription costs to $5.10 for generics. To apply, call Medicare at 1-800-633-4227. Call SHIP at 1-877-839-2675, or simply dial 211 to find help near you and get that application started today. If this video helped you understand something about your benefits that nobody had explained to you before, please subscribe to this channel right now. Then take a moment and share this video with someone you know who is on Medicare or Social Security. A parent, a neighbor, a friend, or someone at your church or community center. One single conversation about what we covered today can genuinely change someone's financial situation for years to come, because this money does not come looking for you. You have to go find it. I will see you in the next one.